So the year is 1793, and our French diplomat Joseph Bonaparte is having a crisis. His mother's second cousin's daughter, who is a single mom, encountered something terrible. Her son, Claude Eugenie Clemenceau, had a heart attack. Oh no, my son! Claude Eugenia's mother rushed him to the local hospital. They arrived at the hospital and rushed to the ER. Oh, doctor, help!
This seems to be a case of coronary heart disease.
What is that?
Coronary heart disease is when the coronary arteries narrow down due to the buildup of fat, resulting to a decrease in the flow of blood. This accumulation in the artery is called atherosclerosis. The fat material clogging the artery can be a result of three reasons: high cholesterol, high blood pressure, and smoking. High cholesterol allows fat to build up on the walls of the artery over time, eventually forming a clog. High blood pressure damages the walls of the artery, making it easier for fats to stick on the wall. Smoking has chemicals which damage the entire artery, letting the fatty material slow down the blood flow. If the clump of fat ruptures, platelets around the area attempting to repair the artery, thus completely restricting any blood flow. If this clot occurs in your brain, you would have a stroke. In your son's case, this clot formed in an artery within his heart, hence his heart attack. Known symptoms of coronary heart disease are chest pain, shortness of breath, and sudden heart attack, indigestion, heartburn, weakness, nausea, and cramping. It is much easier to slow down the process of coronary heart disease, but it is possible to treat it. Statins are the only medication to have a positive impact on coronary heart disease, but they may not work if the person has a cholesterol disorder. Nitroglycerin widens the coronary arteries and controls chest pain. Nitroglycerin can come in many forms, such as patches, sprays, and tablets. Calcium channel blockers also widen the coronary arteries, allowing blood flow to continue. However, the best way to fight coronary heart disease is by reducing the chances of it occurring in the first place. This can be done by quitting smoking, regularly exercising, and eating a healthy diet while avoiding fatty foods. When the medications don't seem to work, what we can do is perform surgery. We can open or replace blocked arteries. Laser surgery involves making several tiny holes in the heart muscle to encourage the formation of other blood vessels. Coronary bypass surgery is when we use a different blood vessel from a part of the body, such as the leg, to attach to the clogged artery to bypass this clog and let the blood flow continue. Angioplasty and stent placement is when a catheter.
What a catheter!
A catheter, by the way, is a tiny tube which can be made of silicone that helps surgeons operate by giving easier access to the arteries by holding it up. As I was saying, angioplasty and stent placement is when a catheter is placed in the artery, allowing a deflated balloon to be inserted. When the balloon is inflated, the fatty material compresses against the wall, once again enabling blood flow. To help keep the artery open, a stent or a mesh tube may be left.
So can you help him?